Welcome back. You're watching McLaren-Port Huron's Today's Health, and I'm talking with board-certified orthopedic spine surgeon, Dr. Neil Pasia. Okay, Dr. Pasia, let's talk a little bit about degenerative disc disease. What are the treatment options for that?
Well, degenerative disc disease is just what the name implies. It's a wear and tear of the discs in your spine. And as a normal process of aging, the discs start to wear out. They start to become degenerative. As the degeneration occurs, it creates more and more pressure between the bones. The bones can start to make spurs, or bone spurs. Osteophytes is what we call them. It can start putting more pressure on the joints as well, the facet joints. All of those tissues around there can thicken and can start to narrow the space for a person's spinal cord. As the spinal cord gets squeezed or the nerves start to get squeezed, people develop radiculopathy, or numbness tingling down into their arms and hands and fingers. It's not always carpal tunnel that's kind of giving them the symptoms. Oftentimes it can be coming from their neck as well. Well, to treat that, we start with, like we've talked about before, diagnosis, imaging. When we come to the point where we're discussing the possibility of options, it ranges from anti-inflammatory medicines. Sometimes that just decreases the swelling around the nerves, around those muscles, around the joints, and helps make things feel somewhat better. And you can manage that quite well for long-term, years, decades. You can do that quite well as long as it doesn't progress. If it progresses, we talk about other options. We talked about changing positions and things like that, but different things with physical therapy. Physical therapy can help strengthen around the spine, can give support to those discs, to those joints. The possibility of injections, epidural steroid injections. Those are available not just for a person's back, but also in a person's neck through interventional pain management, where it's a stronger medicine to decrease the inflammation around there. As far as degenerative disc disease themselves, you can't make that process turn around. You can't make those discs young and healthy again. If it comes to it and all of the conservative treatments have failed, well, you have to consider the possibility of surgery to stabilize the bones, to stabilize those motion segments.
So what are the surgical treatment options?
The different treatment options for a person's cervical spine, it ranges. Sometimes we are able to do a disc replacement or something like that. That's a very small subset of people where their joints have to be quite pristine and the space around their nerves has to be pretty well maintained. That's not a very common surgery, but it is something that could be available. The other possibility would be that something that's much more common would be a cervical fusion, where we go in and you have to remove that degenerative disc that's pressing against the nerves so that it's not pressing on the nerves anymore. Opening up the space for the nerves so that it'll resolve that pain down a person's arm. It'll resolve that numbness, tingling, that burning, and give that nerve a chance to recover, to regain its strength, to regain its function so that a person's much more pain-free and able to function. But if you remove that disc, you have to stabilize the spine as well. To stabilize it, we replace that disc with a spacer and then put a metal plate with screws in there to hold it stable.
Now, is this, can you do that minimally invasively, or is this a hospital procedure? Tell me how you do that.
It's a procedure that sounds probably more scary than it really is. Okay, it is a big deal to have surgery on your spine. It's a major undertaking for a person. These surgeries tend to recover quite well for people. It's a surgery generally, we go in through the front of the neck, through a small incision, just a couple of centimeters in size, so it is less invasive. We're able to kind of get down to the front of the person's spine. The surgery takes maybe an hour, hour and a half or so for a person, and they can start getting up and moving around that same day. Some people are able to get home that very same day. They don't have to stay overnight in the hospital. If they do stay overnight in the hospital after their neck surgery, it usually is just overnight one night and they're home the next morning. They can start their function. They can start getting up, walking around. Usually people are starting driving within just a couple of weeks, but it takes a little bit longer before people are getting back to work, just because we have to give that time to heal. Sometimes if people have light duty, they can get back to work as soon as 3 or 4 weeks. For heavier work or more rigorous activity, it might take several months, 2 or 3 months, before they are able to do that.
Is it a realistic expectation that, and you have degenerative disease, which you've already told us you can't fix, so is it realistic to expect that all your symptoms will be gone? It'll be just like your young neck again?
It's the hope for everybody. Everybody that comes in is hoping that they can just be fixed, or that we can just somehow turn back the clock and make it all okay. No, it's not realistic. We can't make things just as good as new. Your anatomy is a very complicated and amazing structure, really, and we alter it because things go wrong, things wear out, and we can change those things, but we can't make them perfect. But we can make what's quite debilitating for people very, very manageable, and we can take away a good amount of pain in the right circumstances, and that's why we kind of work them up, evaluate it, and do treatment as appropriate.
And a very welcome relief to someone who's had nerve pain and can't sleep like we talked about. So we're going to take a break, come back and talk about herniated discs.